Hi guys, welcome back to my channel. If you are new here, welcome. My name is Ami. I am a nurse practitioner, and on this channel I talk a little bit about nursing. I make videos about mental health. I do hair tutorial videos. I talk about financial tips and things that I've done throughout my life to help me be as successful as I can. I'm also going to be documenting our journey to paying off our student loans. If this is something you're interested in, please make sure you subscribe and join the family. So in today's video, I'm going to be talking to you guys about why I decided to go back to school and become a nurse practitioner. So I'm currently a nurse practitioner. I do have my doctorate as a nurse in nursing practice. And this is just talking to you guys about how my thought process behind why I decided to, after I got my RN, to go back to school to become a nurse practitioner. What are some things that I did to help me get into grad school? And hopefully these things are going to be able to help you as well if you're trying to decide whether you should be a nurse practitioner or not. So for me, working as an RN, one of the major things that helped me decide on pursuing my education to become a nurse practitioner was because I worked mostly in the ICU. So a lot of the time when our patients comes into the ICU, they're already very, very, very sick. So that means that something was missed along the line. So I wanted to get out of the space of taking care of patients when they're at their worst and meeting them at a place where they might not be at their best, but we can prevent them from getting to that point when they're at their worst. So that was one of the reasons why I decided to go back to school and become a nurse practitioner. And also as a nurse, you're very limited in things that you can do to help make a bigger impact. What do I mean by that? So sometimes you're working, for example, when you work in the hospital or even outpatient, you're having to do a lot of the things based on the doctor's order, whether it's a medical doctor or NPs. You don't really have a bigger impact or much of a saying on your patient care overall. While you're providing exceptional care, a lot of the things that you are able to do as a nurse, you're limited. So as a nurse practitioner, it gives you a little bit more of control, or you're able to make a bigger impact in your patients' lives, just because whether it's dependent on what you decide to go to school for. For example, my role is what I went to school for is a family practice nurse practitioner. So you're able to meet patients in an outside setting where they're dealing with different life issues. You're able to have more of a bigger impact because you're taking care of not only sometimes the patient themselves, but you're also maybe taking care of their family, their kids, their husband and partners and things like that. You're able to meet them in a setting where you can have a bigger impact in preventing them from going into the hospital. For example, as a family nurse practitioner, you may be treating the patient's high blood pressure, their diabetes. You're able to help them so that way you avoid them being in the hospital by keeping their blood pressure under control, by keeping their diabetes under control so they don't end up in the hospital. So you have a little bit more of a control over that. What are some things that I did to help me get into graduate school? So for me, I moved from Philadelphia to North Dakota. So that was a major thing in terms of getting into the school one, because you do have an upper hand if you actually went to that particular school for undergrad and now you're trying to go into graduate school within the same school system. So that's actually, if someone tells you that that doesn't count, they're lying. That does count. And how I realized that was that when I moved to North Dakota, I applied to a school down here to get into the program for my NP. And the first time I applied, I actually didn't get accepted. And what I ended up doing was I actually went to the school and met with the dean. I was so devastated, guys. I don't take failure very well. And for a lot of people, it can be very devastating when you apply to a school and you're not able to get in, especially if you're already doing all the necessary preparation to help you get into the school and you swear you're good, because my GPA was good. I made sure that my grades were good because that's something that they really look at when you are going when you're applying for schools. Another thing also to look at was your experience as a registered nurse, and I had a lot of experience prior to applying to NP school. So when I didn't get accepted, I wanted to know what is it that I can do to improve my chances of actually getting accepted the next time I apply to the school, or maybe a different school. So I remember going in and I made an appointment. I met with the dean. I was so sad, guys. I met with her and I was like, hey, I applied to your program. I wasn't able to get in. I'm just trying to figure out what are my chances. What is it that I can do to help me get into your program or other schools around the area? And what she told me was at the time was that being that you did not attend the school usually gives priority to people that went to the school for undergrad, because they already know those students and they know their grades and how they perform. So a lot of the time, you coming in as an outsider sometimes makes it a little bit challenging. Not to say that they will not accept students that did not attend to the school, but it makes it a little bit difficult. So for me coming in, one of her suggestions was taking classes prior to getting into the program. So some classes that, depending on the program but this was the case for the schools that I applied to around the area. It was only two schools, the school that I didn't get accepted to, and then I applied to another school. So she said that I could apply as a non-degree seeking student, and then once I get accepted, I'm able to take classes. So a couple of the classes that I was able to take advanced pathophysiology, which is something that you're going to need if you're definitely going to be a nurse practitioner. So for all programs that's required, you need advanced pharmacology, and then you need your advanced physical assessment. And also for some schools, they require graduate level statistics program. Some schools divide that, in which they do advanced pathophysiology 1 and 2, different semesters. Same thing for advanced pharmacology 1 and 2. So for me, I was able to take 3 of those classes. So I took pathophysiology, advanced pharmacology, and I took statistics. So those 3 classes alone, where I took those classes, and those classes actually count towards your degree. So when you actually get into the program, you don't have to take those classes over, which was a big thing. And that played a major role in helping me be successful, especially that first year when I got into my nurse practitioner program. So that was a big thing that she told me about. One, how does that help you get into the school? You're already in the school system as a non-degree seeking student. And when you pass those classes, the school is able to see that you have taken graduate classes and you have been successful. When you couple that with your nursing, with your previous GPA, undergrad GPA, and also your clinical experience as a nurse, that puts you way ahead of other people that they may not have, even the ones that went to the school, but they don't have graduate courses that they've taken to show that they've been successful. So that was the main thing. And I did apply to the school, and I got accepted to both of the schools. So that was a major thing for me. So if you're thinking about going to school for your nurse practitioner, and look at your program and see if that's something that you're able to do. And it made things a lot easier my first year overall, because when other students were taking 5 classes that first semester, I was only taking 3 because I already took most of the other classes. And the second semester was the same thing. So it made things a lot easier for me when I was in the program. Now, one other thing that I wanted to address when it comes to if you want to become a nurse practitioner is, should you get experience as an RN first prior to going back to school to get your NP? For me personally, I feel as though it is beneficial when you're talking about furthering your education, having that nursing experience. Not just because it will help you as a provider, because when you are a nurse, you are passing medications, even though you're not the one prescribing them, you're passing medications and you're able to learn about those medications. And a lot of the times that knowledge stick with you. And then when you transition into nurse practitioner school, now you're learning a little bit more knowledge about how do you go about prescribing those medications, what different system did it affect. Now everything just kind of makes sense compared to if you just go from RN school and then you jump straight into an NP school. So that clinical experience is very, very, very important. Another reason too why I will advise someone to work as an RN first before going back to school for the NP is because it helps give you a sense of what kind of nurse practitioner do I want to be. So kind of like when you're an RN, you have so many options. You can work in outpatients, you can work in a nursing home, you can work in the ER, you can work in ICU, you can work with pediatrics, you can work as an OB. You have so many options. As a nurse practitioner, you do have those options as well, but now you have to specialize in different things. So, for example, if you are a med surg nurse and you really loved it, or you are an ICU nurse and you really loved it, chances is that you may do really well as an acute care nurse practitioner, which is a different route from if you want to be a family nurse practitioner or if you want to be a psychiatric nurse practitioner. So being able to work as an RN gives you that opportunity, so that way you're able to figure out, okay, what kind of a nurse practitioner that I want to be, compared to if you go from just you get your RN and then you jump straight into NP, and then maybe you decided to go for your psychiatric nurse practitioner and you realize that I really didn't like mental health. Well, that's a kind of a waste of your time, and then you will have to go back to school and get a different postmaster's degree just to be able to work in a field that you may necessarily enjoy, and you may not even like that second degree that you postmaster's degree. So that just really helped decrease those chances overall. And that's pretty much it for this video. Hopefully it's not too long. I hope this video was helpful. If you have any questions about nursing in general, whether RN, NP school, and just things in general, please leave your comments down below. I'm more than happy to answer your questions. Until next time, guys, take care and be kind to one another, and I'll see you in my next video. Bye.